السلام عليكم طلبة المرحلة الخامسة. In our lecture today we will continue the description of the extra-oral examination. Examination of the neck. The dentist should ask the patient to clear the clothes and exposing the neck, and he should note if there is any abnormality in the neck by inspection such as swelling or lump. Examination of the neck divided into parts. The first part, we examine the lateral side of the neck. There is an important structure in the lateral side of the neck, which is the sternocleidomastoid muscle. This muscle divides the lateral side of the neck into a triangle. So, by inspection, we notice if there is any abnormality in the posture of the neck, such as torticals, due to tense in this muscle that lead to slightly deviation of the neck on one side, deviation slightly down on one side, and when asked the patient to straighten the neck, he cannot do this. The other thing that we examine in the lateral aspect of the neck is the examination of lymph nodes. There's many groups of lymph nodes in the neck. The method of examination of these lymph nodes, we should follow certain steps. First, the dentist should stand behind the patient. In this way, the dentist will not focus on certain group of lymph node than the other, but he will focus on all the groups to see if there's any abnormality in them. The patient should put in upright position during the examination, and also the dentist should use both hands during the examination. That means they examine the lymph node bilaterally in the same time, the left and the right. Also, the examination of lymph node should be systematic. That means it started from the submental, then we move to submandibular, then jugular omohyoid, and etc. We can see in this photo the distribution of the groups of lymph nodes and how we examine these lymph nodes by the palpation. And as we said, we started from submental and moved backward to the submandibular and etc. The texture of lymph node is very important indication on certain disease. For example, the hard node suggests malignancy or metastasizing malignancy in the lymph node, while in case of inflammation, the lymph node will be warm, tender, and soft. In case of large, discrete, rubbery, but not tender, this indicates the Hodgkin disease. We should note if any of lymph nodes are found enlarged, the dentist should search the possible infection or abnormality in the area that drainage in this lymph node. After finishing the examination of lateral aspect of neck, we now move to the examination of the midline structure in the neck. The important structure in the midline, it is the thyroid gland. As we said before, it is not the job of the dentist to diagnose if there is abnormality or disease in the thyroid gland. Rather than if he discover or suspect any abnormality, he should refer the patient for a proper diagnosis and the treatment by the physician. Examination of thyroid gland should be first by inspection. This process is easy if the person is thin and young, because the isthmus of normal thyroid gland will be clear and apparent, especially when you ask the patient to swallowing. Otherwise, the normal gland is not visible, like in the obese patient. So there is a method called Buccal method we use for the obese patient. But ask the patient to throwing the hand backward and ask him to press his head backward on his hands in this area. In this case, the midline of the neck will expose and be prominent to see any abnormality in this thyroid gland. Also, examination in the thyroid gland by palpation, and the dentist in this case should stand behind the patient, as you see in the photo, and put his thumb on the nape of the neck, while the other four fingers palpate the thyroid. Ask the patient to swallowing. The normal case, we should felt that the thyroid gland should be felt as smooth and firm. Other things might that mean there's an abnormality in the thyroid gland and needs investigation and refer to the physician. Examination of cranial nerves. This examination not routinely done by the dentist, but it is important for certain cases, such as if there is an accident, such as car accident, or in case there is evidence of all sensory or motor complaint. The first nerve should be examined is the olfactory nerve, which is the number 1 cranial nerve. This nerve that's responsible of the sensation of smell. Its examination, as we see in the photo, by asking the patient to close his eyes, and the examiner should close one nostril, and by approaching a cup in which coffee or lemon, and ask the patient to smell and ask him what is this, and you can repeat it is for 2 or 3 times, and then close the other nostril and repeat the question. The other cranial nerve is the optic nerve, which is the second cranial nerve, which is responsible for the vision, and its examination by using of visual acuity and visual field, in addition to the color vision tests. The other cranial nerves, it is the oculomotor, the third, trochlear, the fourth, and abducens, the 5. These nerves is responsible about the movement of the eye, and it is give the impulse to the muscles that are responsible on the movement of the eye. So any defect in them appear in the defect in the movement of eye, and usually these 3 nerves can be tested by using of pupillary reflex, as we see in the photo, by applying a light on one eye, so both eyes should be constructed at the same time. Moving to the examination of the fifth cranial nerve, which is the Taj Mahal nerve, which is important for us as dentists. The Taj Mahal nerve, as we know, it is divided in 3 parts: ophthalmic, maxillary, and mandibular. So, and it is a mixed nerve. That means it has sensory function and motor function. To examine the sensory function, using a piece of cotton, and by light touch on the cheek, and ask the patient if he sense or feel by this cotton or not, as we seen in the photo in the upper right. And also, can we examine the corneal reflex, in which both eyes should be closed when we try to touch each cornea with a piece of cotton. By putting the cotton near the eye and approaching it to eye, the patient should close both eyes, not just the unilateral, but should close bilaterally in normal cases. To examine the motor function of the Tajima nerve, we use a jaw jerk test, in which we ask the patient to open his mouth, but he's relaxed and in passive way. Then press on the chin by a medical hammer slightly, and in normal case there should be a reflex contraction, which is called press closure. That means when we knock on his chin slightly, the reflex is closing the patient close his mouth. Examination of facial nerve. Facial nerve is a mixed nerve. That means it have sensory branch and motor branch. The motor branches supply nearly all the muscles of facial expression. So during examination, the motor function of this nerve, we ask the patient to wrinkle his forehead and raise his eyebrows as we see in the photo, in the upper photo, and also ask the patient to show his teeth, and also ask the patient to blow out his cheek as in the photo below. By close observation and comparison of the right and left side of the face, we can note any involuntary movement like tick or spasm in any muscle of facial muscles of expression. The test of sensory function by testing the taste in the anterior 2/3 of the tongue that's supplied by the branch from the facial nerve. The vestibular cochlear nerve. In normal condition, patient should equally heard by both ear. This nerve responsible for hearing. So examination is done by using of tuning fork, by holding near each ear and on the mastoid process and on the forehead, and the patient with hearing defect will be better bone conducting than air conducting. The ninth cranial nerve is the glossopharyngeal nerve. It's also a mixed nerve, sensory and motor. To examine the sensory function, we can test the taste in the posterior 1/3 of the tongue, while testing the motor function done by the examination of palatal reflex. When we try to touch the soft palate, it moved upward. The 10th cranial nerve is the vagus nerve. We expect abnormality in the vagus nerve if the patient have nasal quality of the voice, or if he has difficulties in swallowing, or dropping of uni or bilateral of soft palate. Examining of this nerve done by the ask the patient to say ah for long times, and also try to observe the soft palate movement. In case of bilateral palsy, here the palate will not elevate, while if there's a unilateral lesion, in one side of the palate move, while the other side is immobile. Examination of spinal accessory nerve that supply the sternocleidomastoid and trapezius muscles. So we can ask the patient to press the chin downward against the resistance of the examiner's hand, and the other method by asking the patient to turn against resistance from the examiner hand, as we see in the photo below. Examination of hyperglossal nerve. Hyperglossal nerve is a motor nerve that supply the muscle of the tongue, and its examination by asking the patient to protrude the tongue and carefully see if there's deviation. If there is unilateral weakness, it deviated toward the paralyzed side, as we see in the photo. Also, we can ask the patient to move the tongue in out direction and from side to side, slowly and rapidly. Also, ask the patient to press the cheek with the tongue, while the examiner finger resists the movement by pressure from the outside. So any defect in the nerve lead to paralysis, tremor, and abnormality in the tongue movement. The other important extraoral structure that should be examined is the temporomandibular joint. TM joint is very important for us as dentists, and we have separated lecture to discuss it in details. Now we'll take an overview about the examination of TM joint. First, examination of TM joint by inspection, and it include observing the degree of symmetry of the mandible and face, if it is bilateral symmetry, or there's asymmetry, that there's a deviation on one side of the jaw, or like this. Also, observe the path of extrusion of the mandible on opening and closing, and it is helpful to focus on specific landmark. For example, we focus on the mesial incisal edge of the mandible center incisor whilst asking the patient to open and close their mouth. In this way, any lateral deviation will be also be very clear. Examination of TM joint by palpation. The examiner should stand in front of the patient and put the index finger of both hands, left and right, on the head of the condyle, which lie slightly in front of the tragus of the ear, with a slight pressure, and ask patient to open and close with this slight pressure, and ask the patient if he feel pain or abnormal tenderness. Then measure the maximum interincisal distance during opening, as we see in the photos on the left and in the photo in the middle, which is normally equal to 35 to 40 millimeter, and that's equal to 3 fingers of the patient put between the upper and lower central incisor, and if there is distance less than that, that means there is a problem with the TM joint. And finally, in the palpation, we examine the muscle of mastication, as we see in the photo on the below on the right, and we will take the examination of these muscles in details in the lecture of TM joint dysfunction syndrome. The muscle of mastication, as we know, the lateral and middle pterygoid muscle, proximity muscle, and masseter muscle. By examining each muscle, the origin and insertion with fingers. Now we moved to the intraoral examination. After finishing of the extraoral examination, the intraoral examination involved examination of teeth, about number of teeth, caries, filling, loose teeth, crowns, discoloration of teeth, and etc. Also include examination of the gum. The color and texture of the gum are important to note, and the standard of oral hygiene classified, including the presence of plaque, calculus, recession, poking, hyperplasia of the gum is measured. Also, the mobility of the teeth should be evaluated. Examination of the palate will done by inspection. Ask the patient to open widely as he can, and tilt the head of this patient slightly backward. Now the palate will be clear for you, and you can see and note if the patient have ulcer, swelling, colored lesion like white, red lesion, and etc. Also, by asking the patient to say loss of movement of half of the soft palate suggests a lesion of the vagus nerve or infiltration by neoplasm for the nasal pharynx, while paralysis of the whole soft palate is found in the pulpar form of poliomyelitis. Also, we examine the floor of the mouth by asking the patient to put the tip of the tongue on the palate. In this way we can see clearly the floor of the mouth, and also we observe if there is ulceration, swelling, lump, the texture of the floor of the mouth, or any change in the or discoloration, white or red lesion. Moving to the examination of buccal mucosa by retraction, the angle of the mouth and the interior of the mouth eliminated with a torch to examine the color, texture, and the presence of white and red lesion, swelling, or ulceration. Moving to the tongue and examination of the tongue. The tongue is very important, and it is considered as a mirror that reflects the general health of a patient to us, and the tongue tell us the state of the tongue tell us about the health of the patient, if he has a systemic disease or other disease that make him compromised patient. Normally the tongue color is dark red and normally covered with a slight grayish coating. So by inspection we can note the following change maybe occur on the tongue, like excessive furring will be a result from local infection either from the mouth or from the nose, throat or lung. Discoloration of the tongue is very important and tell us about many things. Discoloration may be due to recently taking of certain food that make it pigmented, or maybe due to iron containing medicine that lead to black discoloration. Also, taking of antibiotic for long period make discoloration of the tongue due to the changing of oral flora that lead to candidal infection causing white discoloration. Dryness of the tongue indicate the patient may have a renal failure, also in case of dehydration or xerostomia to many causes, or maybe in patient with mouth breather. In anemic patient, the tongue will be depapulated, smooth and sore, painful and shiny. In patient with other problem, there is a cyanosis. The cyanosis appear in the middle or central part as a bluish discoloration. In patient with acromegaly or Down syndrome, the tongue will be very large and with a scalloped margin and sometimes fissure. In nerve system defect, there is abnormality in the movement of the tongue, as in a case of paralysis, atrophy, also tremor, and other abnormalities of movement. Examination of the anterior 2/3 of the dorsal surface of the tongue done by the catch the tip of the tongue with a piece of gauze and move the tongue left and right to see if there's any abnormalities such as large size than normal, inflammation, muscular hypertrophy, or other abnormalities. Also, examination of the ventral surface, as we see in the photo below photo, but ask the patient to put his tip of tongue on the palate to see the ventral surface if there is varicocele, if there is ranule or any discoloration or abnormality in the tongue. Examination of posterior 1/3 of the tongue. This is not usually done, but is should be done in case of the patient has a discomfort at the back of the tongue, or he has a slight dysphagia or doubtful ankyloglossia. The examination include asking the patient to open mouth widely and press the left index finger firmly into the cheek. Then palpation the root of the tongue. If the patient have a gag reflex, you can in this case use spray anesthesia to reduce the gag reflex and we be able to examine the posterior 1/3 of the tongue. Neurological examination of the tongue is the same as we described in the examination of the hypoglossal nerve that supply the muscle of the tongue. Next is the examination of salivary glands. The dentist, before examining the salivary glands, should know and put in his mind the following things. First, position of each major salivary gland, the parotid, submandibular, and sublingual glands. Also, the clinical feature that related to each salivary gland disease. And finally, the investigations required for every symptoms of salivary gland disease. Clinical examination of salivary glands involve observing any asymmetry and detectable extra or intraoral swelling. Sometimes large calculi in the duct of salivary gland can be palpable and patient feel hardness. Saliva should be carefully noted if it is turbid or mucopurulent. Then sometimes there is a pus in the discharge with saliva. pain and the skin involved with a firm, rapidly growing mass. Facial nerve palsy, as we know that facial nerve penetrate the parotid gland on both sides, so any abnormality in the facial abnormality in the parotid gland may make pressure on the facial nerve, and patient have certain symptoms. Also, the lymph node detected in some infections of parotid gland, and hypersalivation may be associated with certain neurological disorder. And the main symptoms, if there is abnormality in the salivary gland, is a decrease in the secretion of saliva and a result in dry mouth. Moving to the parotid gland, when dentist notes a swelling inside of parotid gland, he should examine it as following: by inspection. The characteristic of the general enlargement is a swelling in the front of the tragus of the ear, extending downward and slightly backward, and obliterating the normal depression below and in the front of the ear. To examine the parotid glands, the dentist should stand behind the patient, as you see in the photo, and put both hands bilaterally on each parotid gland on each side, putting the tips of the finger of each hand and feeling the constancy of the parotid gland, or if there is swelling in parotid gland or not, or if there is any tenderness with a slight pressure of the fingers. Also, examination of parotid gland include inspection by asking the patient to open his mouth and retract his cheek and see the orifices of the duct of each parotid gland. As we know, the duct lie opposing to the upper 7, and see if there is pus discharge or any abnormality or decrease in the secretion of the saliva. All these observed by inspection of the orifice of the parotid gland. Moving to the submandibular salivary gland, here the dentist notes a swelling beneath and in front of the angle of the jaw, or if the swelling occurs only either just before or during meals, this may give an indication that the submandibular salivary gland involved. Any swelling at this area should be differentiated from other swelling in this region. Thank you for your attention.